Welcome to this podcast from MD Briefcase, presenting knowledge and insights from key opinion leaders in medicine. Our independently produced podcasts are especially designed to support your practice. We hope you find it useful and informative.
Hi, welcome to today's podcast where we're going to be exploring the exciting area of hepatitis C, which in Australia is amazing because we can have the drugs and we can treat it. But there's still some barriers. In particular, stigma still seems to be one of those things that we need to discuss and see how we can improve stigma that is sometimes directed towards people or felt by people who have chronic hepatitis C. I'm Dr. Annie Borkham and I'm a GP who's worked for many years in viral hepatitis. And to help us have a bit of a chat about this topic, I'd like to welcome Dr. Nada Andrick, who's going to be here. Nada, do you just want to introduce yourself first?
Hi everyone, I'm Nada. I'm a GP. I work in Sydney with refugee health as well as in private practice. Thanks, Annie.
We now know that we still have about 120,000 people in Australia living with chronic hepatitis C. We've treated probably over 50% since we've had the exciting new DOAC, new agents, the direct-acting antivirals since 2016.
Yeah.
But what do you think may still be some of the barriers that, why haven't we treated everyone?
Yeah, I think it's such a fantastic treatment, isn't it? And really it's been so nice to share the journey of treatment and cure with so many patients. And you kind of think, gosh, I think everyone should, who can access the treatment, should access the treatment. So it is interesting to know that we've had good uptake with this really good group of medications. But I think finding people who are happy to, get tested, finding the right patients has been a challenge for us. I think many of the patients we've treated, we know have been engaged in care, and the rest of the patients who might not know much about the treatment availability or might not even know they're living with hepatitis C or are actually just avoiding treatment or the entire healthcare system need to be offered this fantastic capacity for cure. And really, it is a life-saving and cancer-saving treatment. So we should really be able to offer that to everybody. So I think the reasons why people aren't accessing treatment is sort of multifactorial. But I think one of the reasons we're going to discuss today is the stigma that's surrounding chronic hepatitis C, even in this era of cure.
I mean, do you think that patients with hepatitis C are likely to experience stigma in general practice in particular? Or?
Yeah, I'd love to say no. I think, when I think of general practice, I think, we're just such a bunch of well-meaning and really down-to-earth, hardworking practitioners with great intentions and really good knowledge. But I have to say that, stigma in general practice starts from the moment even before someone enters the practice, from making an appointment in a practice to sitting in a waiting room to, maybe even experiencing flippant commentary from a tired and well-meaning but tired and hungry doctor. So I'd love to think that patients don't experience stigma, but I'm pretty sure they do in general practice, yeah.
Yeah, and I mean, the interesting figures from the Australian Stigma Indicators, they did a monitoring project in 2018 and they found that 1 in 5 healthcare professionals surveyed as part of that indicated that they would behave negatively towards people living with hepatitis C to some extent. Yeah, although less than 1% indicated that this would be often or always. But what does this surprise you, or what do you think might be behind this?
It's really interesting, isn't it? I mean, when I think of the patients that, and I'm sure you're the same, treated all these lovely, wonderful patients who happen to have chronic hepatitis, I would never think that any of our behaviours around them would be stigmatising, or we would treat people with these conditions any differently. But I think that the word hepatitis, invites these assumptions of someone's behaviours or of someone's character, and then these judgments. So I think we're human first and foremost, I guess, in GP land, but also sort of as medical professionals and health professionals. And so some of those assumptions we just need to check and really reflect on, because, how on earth would you even know someone has hepatitis C? So I find this concept of behaving differently to someone quite interesting. Yeah.
And again, the whole concept that people who inject drugs, that you can tell who is someone who injects drugs, like that's what often staggers me with this whole idea that you can, it's a bit like, can you judge someone who goes to the pub on a Friday night and has, 3 beers versus someone who has a whole bottle? I mean,
that's right.
It just it is a bit mind-blowing at times. I mean, I'm certainly sure that it's because it's recreational drugs are not decriminalised in Australia.
Yeah.
And it is interesting in places like Portugal where they have decriminalised it. I'd be curious. The stigma there seems to be a lot less. But I mean, it's interesting. We need to get that message over, don't we? That 6 out of 10 people living with hepatitis C, if they did get it through recreational drug use, it's years ago, or they might have just done it, and it's not. So it is a weird label that we've created, isn't it?
I think so. And I think, those judgments, they might really be flippant comments that have been made many years ago, but any of those things that, you could, I guess, hear as a patient can really change the way you interact with health services in the future. And I think, you're right. I think the fact that it's got that sort of criminality around injecting drug use, we kind of auto-associate people with, moral failings, or sort of just being, we may do that, and we may not even really realise we're doing that. I think it's really important to reflect on that as well. I think sometimes you can think that you're doing a fantastic job in general practice and you're really open and down to earth and and things are going really well. But I think it is really important sometimes to really take the viewpoint from the patient. And I'm sure you're the same. We've been to a lot of education around, the actual lived experience of the patient. And it's really sometimes quite mind-blowing how real that can be to somebody. So I think we really need to, as health professionals, just take a step back and think about how it might feel for somebody, entering a service that's brand new to them. Yeah.
And it was interesting also too, that same Australian Stigma Indicators Monitoring Project showed that over half of people surveyed, healthcare professionals, surveyed, indicated they would behave negatively towards people who inject drugs. So again, it sort of seems to, the label is, if you have chronic hepatitis C, then you must have injected drugs at some point, which is a very bold presumption.
and I guess, it really shouldn't make any difference. Like, for us as health professionals, it's like, okay, we've got someone here who may have chronic hepatitis. How can we help them either cure it if it's hepatitis C, or manage it if it's hepatitis B? I think any of those, how somebody may have, picked up the virus is really nothing that we should even ask sometimes. So it is interesting how honest people seem to be as well in that survey. Potentially, that's a lot of people. So even if you weren't being honest with yourself, it might even be more.
Yeah, no, it is. It does make you realise that it is. It's huge. So it is something that we need to unpack and keep exploring, and do a lot more education with health professionals of all, from every walk of life, because I think particularly emergency departments at hospitals are one of the places I see it sort of very regularly. How do you think stigma might negatively impact outcomes or just people's readiness to engage in treatment?
Yeah, I think you're right. I think that even, any of those negative experiences from any part of the health system, or even hearing about other people's negative experiences, can really impact, stigma, or even perceived stigma. And I think, it will stop people firstly coming through the door. What a tragedy it would be in 2021 that somebody, doesn't seek treatment for something that's curable because of the attitudinal judgments they've had in the past, and the potential for them to, experience them again. So really, what we're doing if we don't change our, I guess, attitudes in healthcare is really marginalising even more marginalised people, and seeing those people potentially be avoidant around their general health care, present late, they might not present in a timely fashion, and again, we might invite judgments on all of those sorts of behaviours. So I think we see that as well in other illnesses like, severe mental illness and so forth. We see that people will present late or avoid medical services because of their previous engagement with those services being negative. So I can only see that stigma really impacting very negatively in the outcomes of patients living with hepatitis C.
No, I really like what you said earlier, Nadia, about how we should be looking at hepatitis C cure really as a, one, as we've always said, how exciting we finally got a chronic disease, one we can cure. But I think we just need to change it into terms of disease prevention, chronic disease prevention, and liver cancer prevention, and then it doesn't matter how you take the stigma out automatically. I know we've talked about that at all, and I really think that's the way as health professionals, it's our role. It's almost you would not want to do something to prevent cancer in any disease. So it's like I think it's a bit of a challenge that we need to throw out to all health professionals now. This is part of your role to find every person with hepatitis C and B in Australia. And it's part of your general care. You can't opt out of it anymore. It's a bit like doing a pap test or a mammogram or whatever. It's like, this is what we need to be doing, and it's our core business.
It is our core business. And I think that is the challenge, isn't it? I think if there is a reason why one of your patients in your practice can't speak to you about chronic hep C, really that reflection on what might it take for that person, what kind of changes in our practice, what kind of changes in my practice might make that person actually quite comfortable in talking about it again. I think that would be a challenge, for all of us to just improve our empathy and, I guess, kindness and openness to patients with hepatitis C. I think that would be a real challenge for some of us who've treated quite a few patients with hep C as well.
And have you got some ideas of ways that primary care practitioners may be able to find people who have chronic hepatitis C in their practices, and ways beyond that too, ways of maybe overcoming stigma or encouraging people within the practice to who visit the practice to feel comfortable?
Yeah, I think absolutely comes from that. It's got to start from that leadership level, from the GP in a GP practice, that self-reflection and that understanding of, what sort of language might I be using? What sort of things may I change in a practice? What kind of signage do I have up? What kind of education should we do as an entire practice, about people living with a bloodborne virus, or people living with hepatitis C, or people living with mental illness? Really, that whole kind of understanding and empathy and non-judgmental approach, I think, needs to be sort of, from the door all the way through to the practice. When you do a really good job and you do treat someone's hep C, and then they sort of quite thankful at the end about how easy that whole process is, you do realise that it's still very stigmatised when somebody sort of says, okay, that was great, but I can't tell any of my friends. So you still realise that even though you've done your best, there's still quite a bit of community stigma around. And so I think that understanding of, like, that embracing all members of the community, even broader than Hep C. At Refugee Health, we have some lovely signage that, lots of different languages, beautiful rainbow, which says welcome, in many different languages. And I think, we really need to be quite open to, in general practice, speaking to people from all walks of life and being comfortable doing that. And I think that if you're in a practice that can show that, then I think that we'll be much more likely to be approached by people who have been living with this burden for such a long time. We know that a lot of people aren't diagnosed yet, but we do know that many are and are avoiding treatment because of stigma, and that's a huge burden to be living with. Not only do you feel terrible because you have a chronic virus going on in the background, but that kind of psychological burden of having something that you're treated differently for. I think we really need to look at that, through all aspects of healthcare. Yeah,
particularly looking at from the cultural and linguistically diverse background. I think that's the other big population too that we're probably not diagnosing, so that country of birth becomes just one of the things that should be a red flag for, having a person for viral hepatitis B and C if they're born in certain countries, along with if their liver function tests might be up a little bit. You sort of don't presume it's fatty liver, but I think that a lot of people from cold communities also describe a fair bit of stigma. They don't want to know they've got Hep C or Hep B. So again,
absolutely. I mean, and people,
they feel too, even,
Yeah, that health literacy is quite different across different communities, and we can definitely see that from hepatitis B and communities in rural communities in China who, even sort of simple stuff around transmission, actual education around the viruses and how people pick it up. I think, that sort of stuff is really important. That idea of being infective or transmissible, or I think those things really do change people's mindsets and self-esteem and capacity to sort of engage with other people. I mean, your quality of life would be quite severely impacted just by thinking that you may have something that could be easily transmitted to other people. So I think we do all have a role in sort of diagnosing and then really understanding hepatitis, and then talking to our patients about transmissibility and the ease of, I guess, treatment. But knowing that's also a journey. In general practice, we're really lucky. We can see these patients and then see them during and before and after treatment, and it would be a really lovely thing to be involved in. As we said before, something life-saving and something cancer-preventing and something so simple. Like, imagine like a couple of months in and you're like, okay, there goes my chronic disease.
It's quite a joy to be part of the journey, really. Well, thank you very much, Nada. That's been a wonderful discussion, and I hope that we, can inspire a lot of other health professionals around and our colleagues in primary care to take up the challenge and identify and find as many people in their practice that may still not know they have hepatitis C or be living with hepatitis C, and take them on the wonderful journey through treatment and cure, and reach the WHO goals of elimination of hepatitis C in Australia by 2030, which we're all aiming for. So thank you very much.
Thanks, Annie.
Thank you for listening to this MD Briefcase podcast. If you'd like to explore our full range of podcasts, videos, and accredited programs, please visit mdbriefcase.com.au.